Hello, I'm Alexandra Wagner, and today I will be presenting on undocumented immigrants, specifically the barriers to healthcare access that they face and their subsequent utilization of emergency room services in the United States. The U.S. government defines undocumented immigrants as any individuals who entered the United States illegally, without the proper authorization and documents, or any individual who entered the United States legally and has since violated the terms of his or her visa, or overstayed the time limit. There are an estimated 30 to 40 million undocumented immigrants globally, with over 12 million of them estimated living in the United States. These numbers have risen drastically since 1990, when only 3.5 million undocumented immigrants were estimated in the country. Between 2007 and 2016, estimations decreased slightly. However, estimates have begun to rise yet again and are estimated to have surpassed 12 million. 53% of these undocumented immigrants are thought to be from Mexico, with El Salvador accounting for the second highest percentage of undocumented immigrants at 6%, and Guatemala in third place at an estimated 5%. It's estimated that 53% of these undocumented immigrants are uninsured, compared to the estimated 13% of the entire U.S. population. In 2010, the Affordable Care Act, sometimes referred to as Obamacare, was signed into law by President Obama. This legislature expanded Medicare to cover more low-income individuals, as well as established a marketplace, which expanded the availability of affordable health insurance to those who had previously been uninsured. However, undocumented immigrants were specifically excluded from this expansion and remain ineligible for both Medicare, as well as are not eligible to purchase insurance on the marketplace. Undocumented immigrants can be covered by workplace insurance. However, it is estimated that only a few tens of thousands have access to this employee-provided health care. The remaining population has the option to purchase private insurance independently. However, the significant cost associated with this and a plethora of other barriers commonly prevent them from doing so. One recent meta-analysis on the health care barriers experienced by undocumented immigrants identified 341 relevant articles published within the past 10 years, of which 66 were used for the analysis. Researchers found that barriers to healthcare access existed across three levels: the policy level, healthcare system level, and individual level. After legal barriers to purchasing insurance, such as the ACA restrictions, the next most common barrier cited by undocumented immigrants was a fear of deportation, of which was discussed in 43% of the study's articles. Barriers at the health system level included the staggering cost of health care for the uninsured, discrimination experienced by undocumented immigrants based on the status of documentation, as well as an inability to navigate the complex paperwork necessary to gain access to health care. Individual-level barriers to accessing healthcare included communication barriers between undocumented immigrants and healthcare providers, as well as limited knowledge about how the healthcare system works. When undocumented immigrants do seek out healthcare, they are most likely to seek out care in the most easily accessible and commonly known healthcare setting: emergency departments. The Emergency Medical Treatment and Labor Act is a federal law that requires emergency departments to assess, treat, and stabilize any individuals who come into their facility, regardless of that individual's ability to pay. The law only requires any individual with an emergency medical condition be treated, defined as a condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention could reasonably be expected to result in placing the individual's health, or the health of an unborn child, in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of bodily organs. However, All patients must be screened and seen by a provider to ensure that they are not classified as having an emergency medical condition. And this puts a significant strain on ER departments, specifically those along the US-Mexico border. These types of hospitals that provide a much higher proportion of uncompensated care than the national average are referred to as disproportionate share hospitals. These hospitals can apply for increased funding from Medicare to help subsidize the cost, but ultimately, the Emergency Medical Treatment and Labor Act is an unfunded mandate, meaning that the cost of this care typically falls on the facilities and providers themselves. This health delivery issue of interest highlights the significant equity gap between U.S. citizens and undocumented immigrants within the United States. In 2001, the Committee on Quality of Health Care in America, under the Institute of Medicine, published the report, Crossing the Quality Chasm, a new health system for the 21st century. Within the report, they called for a dedication to 6 aims for improvement, one of which called for improvements in health equity in order to ensure health benefits for all people of the United States. It's important to note the difference between health equity and health equality. With health equality calling for providing the same service provisions, and health equity calling for providing additional services to those in the most need in order to attempt to even the gap in that manner. Not only are undocumented citizens not being provided with equitable health care, but they're not also being provided with equal health care. Some may argue that as non-US citizens, they're not afforded the same right to equity that the quality chasm is calling for. However, as active participants in the American healthcare system, something must be done to address this health delivery issue for the benefit of undocumented immigrants, as well as US society overall. The barriers to healthcare access and subsequent usage of ER departments as safety net clinics is a health delivery issue that must be addressed to protect the quality of our ER department, as well as drive for health equity across the population. One solution that has been suggested is the expansion of the Affordable Care Act's marketplace to allow undocumented immigrants to purchase insurance similarly to the rest of US citizens. This initiative was first suggested by California and is designed as a state-funded initiative to increase health equity among California's population of undocumented immigrants, as well as reduce the financial and service burden on the state's hospitals and ER departments. While the marketplace insurance is currently subsidized by federal funds, the expansion to undocumented immigrants would be on a state-by-state basis, with the state, not the federal government, subsidizing the program. The goal of such an initiative would have 3 primary goals. First, the program would aim to improve health equity by increasing undocumented immigrant access to affordable health insurance. Secondly, the program would seek to decrease the usage of ER departments as safety net clinics. This program would hopefully decrease the financial and service burden currently present on hospitals, especially along the US-Mexico border. Lastly, this program would seek to increase the utilization of preventative and primary care services to both improve overall population health, as well as hopefully reduce the cost of expensive secondary and tertiary care. Evaluating the success of this program would want to target 3 primary outcomes: the overall effect on health equity, the benefit to hospitals, and the benefit to the overall health system. To evaluate benefits in health equity, we would want to look at whether implementing this program resulted in an increase in the number of insured undocumented immigrants, as well as if this program resulted in a decrease in perceived barriers to access. Secondly, we would also want to look at the program's impact on affected ER departments. Did ER departments in states who implemented this program see a reduction in their facilities' amount of uncompensated care? Additionally, did the ER department have a decreased burden, especially in relation to non-emergency conditions seeking care via the emergency department? For the overall health system, we would want to conduct a cost-benefit analysis for each participating state to see if the money invested in the state-funded Affordable Care Act expansion to undocumented immigrants resulted in any savings in healthcare expenditure. We would also want to see the impact of the program on population health outcomes, specifically looking for an increase in preventative and primary care usage. Thailand is the only country in the world that allows undocumented immigrants to enroll in their universal healthcare scheme, similarly to this proposed U.S. solution. The proportion of their undocumented immigration population is comparable to the United States, with approximately 2.5% of Thailand's population estimated to be undocumented immigrants, compared to the United States' 3 to 3.5% rate. Although Thailand is a middle-income country compared to the high-income status of the United States, they have done significantly well in terms of their universal healthcare system and its associated health outcomes. Thailand's average life expectancy is 75, compared to the United States' average life expectancy, which is 79. Additionally, the following graphics compare the United States and Thailand's performance in 3 areas: the percentage of the population insured, the amount of services that are provided under their insurance, and the percentages of costs covered by insurance. As you can see, Thailand is performing ahead of the United States across all of these domains, while at the same time spending a significantly lower percentage of their GDP on healthcare costs. This suggests that a similar approach in the United States may be effective. As I mentioned earlier, California is currently in the process of attempting to initiate the first state expansion of the ACA to cover undocumented immigrants. In 2016, California's Medicaid Assistance Program, known as Medi-Cal, initiated their Health for All Kids program. This initiative was able to expand Medi-Cal health insurance to all children regardless of their immigration status. This opened up Medi-Cal enrollment for over 170,000 children, previously uninsured, solely because of their documentation status. The state is still working to promote the idea of health for all, in which this coverage would be expanded to all adults, regardless of their immigration status. However, this goal has not yet been realized. The current administration's shifting approach on healthcare and immigration has significantly slowed progress and created an environment where our proposed program would require a great deal of legal efforts to enact. Significant barriers, especially in relation to fear of deportation and discrimination, remain and must be addressed if the United States is to implement a state-funded ACA expansion. Current policies are causing significant health inequities as well as putting a massive drain on ER departments and hospitals. It is not until the United States addresses this ever-pressing service delivery issue that improvements will be seen, not just for the undocumented immigrant population, but for the United States as a whole. For more information, you can explore my references here. Thank you for listening.